5 Principles of a Trauma-Informed Approach. Safety. As we find ourselves still coping with the pandemic, the principles of trauma-informed care can be used to develop our organizations in ways that empower workers to better support quality of life for residents and clients. Safety is one of the 5 principles of a trauma-informed approach. The principle of safety is considerations for physical and mental health and safety. COVID-19 created conditions where we are seeing our physical, mental, and emotional safety through new lenses. Safety became a central consideration for the entire world. We had to adjust in ways we never anticipated. As the pandemic progressed, we felt an increased need to prioritize mental and emotional safety. We began to better understand how these were deeply linked to physical safety. We prioritize safety in lots of ways: by staying physically distanced from loved ones, engaging mental health resources differently, and talking about our emotional health, to name a few. Those who work in the field of long-term care were faced with ever-present threats to safety, such as exposing their own families when returning home, lengthened shifts with ever-increasing demands, and overwhelming exhaustion. Trauma-informed approaches that prioritize safety help us to think intentionally about the ways our physical, mental, and emotional safety have been compromised. Prioritizing safety means that employers think about their employees' physical, emotional, and mental safety when developing policies and practices. Organizations can use techniques such as Code Lavender to respond to safety concerns in the workplace. Code Lavender is an approach attributed to Rabbi Susan Stone, where workplaces create practices that prioritize safety. Code Lavender is used when a particular employee needs an emergency break because the current situation has become overwhelming to a point where it is threatening their physical, emotional, or mental safety. In this practice, the employee is empowered to tell their team members it is a Code Lavender. In that moment, the team members know their coworker needs to step away from their current work duties and take a break. The break allows the employee to recenter and return to work obligations when they feel more secure in their emotional, mental, or physical health and safety. To establish a Code Lavender practice, an organization can follow these steps. Teams decide together how the employee's responsibilities will be covered during Code Lavender. This will look different for different kinds of teams. Supervisors and managers should write out a brief practice outlining how Code Lavender will be carried out in teams. Don't overcomplicate it. Code Lavender can be as simple as an employee's manager supporting their work while they are on break, or identifying buddies within a team. One's buddy is the person who takes your responsibilities for a period of time, and vice versa. The policy and practice should be communicated clearly to all employees. Identify a quiet space out of the way. Break rooms or heavy traffic areas are not ideal. If one must use a break room, use a screen or divider to create privacy. Think about the 5 senses when outfitting the space. If possible, have dim or adjustable lighting. If lighting is not adjustable, you can offer a calming eye pillow or sleep mask. The space should be quiet. If it's not possible to completely separate the space from outside noise, headphones can be used to allow participants to experience calming sounds. Aromas such as an essential oil diffuser or open teas can have a calming effect. If a window is available for fresh air, this can also be calming. Have the space stocked with objects to relieve stress. You can utilize small bean bags, fidget spinners, Play-Doh, clean blankets, or small puzzles. Finally, stock the space with snacks and beverages. Calming teas are a great option. If possible, offer gluten-free, low-carb, and dairy-free for a range of options for dietary needs. Engaging your team in creating the space is a great way to get started. Team members can share their ideas for techniques they use to relieve stress. Including your employees in developing the space also contributes to collaboration, which is another trauma-informed principle. Once you have created your policy in the space for a code Lavender, make sure the practice is widely communicated. This can be done by posting the policy or practice on shared bulletin boards, asking managers to share in team meetings, and sending organization-wide emails. When safety is prioritized, each member is empowered to invest in their workplace community where they feel protected and seen. Ultimately, approaches such as Code Lavender can reduce sick days, absenteeism, and help to reduce turnover. How will you engage the principle of safety in your workplace?